Hello, thank you for visiting my poster today. My name is James Knockleby, and I'm going to talk to you today about some findings that are emerging from our wastewater surveillance project in the eBazetta lab, titled Advancing Public Health Surveillance in Northeastern Ontario, Utilizing Digital PCR in Wastewater-Based Epidemiology for Sexually Transmitted Infection Detection. This work has been carried out by a talented team of individuals listed here that I wish to acknowledge. Before I continue, I will announce my disclosures of affiliations and support. I am currently an employee of Health Sciences North Research Institute and have an adjunct appointment at Laurentian University. Our research is funded by the Ontario Government Ministry of Environment, Conservation and Parks. We have partnerships with the MECP, public health units of Sudbury District, North Bay and Parry Sound, Algoma, Timiskaming, and Porcupine. We've also partnered with the wastewater treatment plants of Greater Sudbury, North Bay, Sault Ste. Marie, Haileybury, Kirkland Lake, Kapuskasing, and Timmins. Today I will tell you about our ongoing study into identifying sexually transmitted infections in the communities of Northeastern Ontario using wastewater-based epidemiology and digital PCR-based molecular assays. Wastewater-based epidemiology can be used as a tool to help to understand the extent and spread of many diseases. Initially developed in the 20th century to follow such pathogens as polio, it was determined that pathogens can be found in sewage systems shed from both asymptomatic and symptomatic people in feces and urine. Since then, wastewater surveillance has been expanded to surveilling other pathogens such as influenza and COVID-19. As the world was dealing with the COVID-19 epidemic, the tracking of other pathogens fell by the wayside. In particular, sexually transmitted infection surveillance was limited by the restrictions implemented to prevent the spread of COVID. However, STIs such as gonorrhea and chlamydia remain a worldwide concern. There are many debilitating conditions associated with infections such as blindness, sterility, and increased susceptibility to HIV infection. So while the spread of infections can promote antibiotic resistance, leading to a failure of treatment and the inability to control infections. Therefore, in order to get a sense of the extent of STI prevalence in the population of Northeastern Ontario, we sought to assay the wastewater of 7 small and medium-sized Northeastern Ontario communities over the time period of December 2023 to March 2024. Our methodology involved using commercially available digital PCR assays in order to facilitate the rapid development of the testing. We found that the limit of detection of these assays, as listed in Table 1, was 4.7 copies of DNA per milliliter for chlamydia DNA and 8.7 copies of DNA per milliliter of gonorrhea. The municipalities that we surveyed are listed in Table 2 and range from about 94,000 people in Sudbury to 2,300 people in Haileybury. Our workflow is outlined in Figure 1. The sewage is collected at the wastewater treatment plants, and we generally collected a 24-hour composite sample from post-grit raw wastewater. The sample is shipped to the lab, and we concentrate the solids via centrifugation and extract the nucleic acids through a silica column-based method. The concentrated nucleic acid is then quantified using digital PCR. Our method from QIAGEN involves using microfluidic plates with about 25,000 partitions per well. The PCR is performed and the endpoint signal is measured. Positive partitions are identified and quantified using statistical methods to derive an absolute value of DNA concentration in the well. The DNA concentration is then expressed as copies per liter of original wastewater. As outlined in Figure 2, we were able to identify and track chlamydia DNA in all 7 of our communities over the course of the collection season. In Sudbury, we found multiple days in December and January where the signal was above the limit of detection. Timmins and North Bay also had detectable levels in December and January. The 3 centers also had intermittent signal throughout the rest of the sample period. Sault Ste. Marie and Kapuskasing only had 3 days that were detectable above the LOD, whereas Haileybury and Kirkland Lake only had 1 day, but there were trace levels on other days as well. Taken together, we were able to identify chlamydia DNA in all of our sewer sheds. may have identified clusters of outbreaks in some centers, but we require case data to determine if these align with known clinical identification. During the same time period, we also found gonorrhea in 6 out of 7 of our municipalities. Most of the signal was present in December and February. The similarities in patterns may suggest linkages to common outbreaks or perhaps the seasonality of infection. More collection is ongoing to determine if there are yearly trends. In collaboration with the Public Health Unit of Sudbury and districts, we obtained case count data for gonorrhea infections during the time period we collected wastewater data, and the results are presented in Figure 4. We find that the case count and median concentration of gonorrhea DNA is significantly correlated using the Kendall-Tau statistic. These data act as a proof of principle of tracking gonorrhea outbreaks in the wastewater as a complement to traditional clinical tracking. As our data indicate, we have successfully isolated and quantified the DNA of gonorrhea and chlamydia from the wastewater of Northern Ontario communities. The trends we see have been correlated with clinical testing in Sudbury. Efforts are underway to determine if these correlations hold for other centers. We now have samples archived that can be further analyzed to identify what strains are present in Northern Ontario and if they contain markers of antimicrobial resistance. This data can be utilized by public health units to cross-reference their results and determine if there is further unidentified spread of STIs in the community. In conclusion, we have shown that wastewater-based epidemiology can be expanded to surveilling gonorrhea and chlamydia in Northeastern Ontario and can be further developed as a tool to help mitigate the spread of STIs and antimicrobial resistance.